The Ministries of Health and Education have outlined the COVID-19 vaccination plan for children who fall into the 12 to 18 age group. During Monday's Ministry of Health COVID-19 press conference, Minister of Health Terrence Deyalsingh confirmed that the vaccination rollout for children in this category will begin on Wednesday. Khrystal Wilson reports.
No appointments necessary. This from the Minister of Health, Terrence Deyalsingh, as he listed the 14 centers where children can get inoculated against the COVID-19 virus starting this Wednesday. Last week, Trinidad and Tobago received 305,370 doses of Pfizer vaccines. It's the only vaccine approved by the World Health Organization for children ages 12 and over. On Monday, the Minister of Health explained the Ministry of Health's latest vaccination rollout is open to children in that age group.
If you are 12 to 18 and in school, it's open to you. If you are 12 to 18, you are not in school, it is open to you. If you are 12 to 18, you're a child of a migrant, whether you're a Venezuelan migrant, whatever, it is open to you.
Minister Deyalsingh said only one parent or guardian will be accommodated per child to be vaccinated.
To manage crowds, we are asking that one parent per child or per household, if you have 2 or more children in that age group, one parent come in with the minor. That will help us manage crowds and help us maintain social distancing.
Adults accompanying children for vaccination are asked to bring proper identification as well as the child's birth certificate to ensure the vaccination process runs smoothly. Among the 14 vaccination centers for inoculation of children are the Heliport Chagaramas, the Costad Campus Napa, the Diwali Nagar and the Pleasantville Technology Center MIC San Fernando. Information on all vaccination sites for the 12 to 18 category are available on both the Education and Health Ministries' social media platforms and websites. Khrystal Wilson, TTT News.
Meanwhile, Education Minister Dr. Nian Gadsby-Donnelly is assuring the reopening of schools is not predicated on how many students get vaccinated. Minister Gadsby-Donnelly said, as it stands, the situation is still very fluid.
It is really up to parents to decide whether their children will be vaccinated or not. However, I am not under the impression that the opening of school is predicated on the students' uptake of the vaccine, or else we would have a great uncertainty in that regard.
While the actual vaccine rollout falls under the Ministry of Health, Minister Gadsby-Donnelly said her ministry will be supporting the MOH in this initiative and will monitor the vaccine outtake. Take it easy after you have been vaccinated. The advice comes from Dr. Joanne Paul, Regional Coordinator Emergency Medicine of the North Central Regional Health Authority. Dr. Paul was among the panel during Monday's Ministry of Health COVID-19 update and urged parents to ensure their children have some downtime after being inoculated against the virus.
Don't have any activity for that week. Make sure it's light activity. We don't want to have any 5Ks being run. And once you have the vaccine, take it easy for that week, less activity. No, even for the athletes out there, be restful for that week and just relax.
Dr. Paul also encouraged the parents to get their children vaccinated, especially now that the Delta variant has arrived.
Delta is here, and we're going to have increased amount of cases coming to the hospital, and infectivity is higher. The Pfizer vaccine, it does cause in a few cases myocarditis, but it's very rare. It's 1 in 2 per million. Now, if we have 100,000 children in terms of secondary school age children who are between 12 and 18, that means it's 1/5 of a person to get myocarditis. In terms of if we were to vaccinate all our children between that age, it means that we'll have to vaccinate the entire Caribbean to actually have one case. It's so uncommon.
There have been 8 more deaths due to COVID-19. The Ministry of Health says 6 men and 2 women succumbed in the last 24 hours. One of the men had no comorbidities. This takes the COVID-19 death figure to 1,188. Meanwhile, 89 new positive cases of COVID-19 have been reported. The samples were taken during August 12 to 15. The total number of active cases is now 5,990. 315 of those cases are patients at hospital.